You're listening to Health Professional Radio. My name is Wayne Buckler. Today my guest is Mathew Cherian. Mathew's the CEO of Global Health, an Australian firm that has a story to tell us. Mathew, welcome to Health Professional Radio.
Hi Wayne, thank you very much for having me.
It's my pleasure. Now Mathew, Global Health is a technology company. Tell us what it is that you produce or offer, or what your products and services are, and also what is your geographical footprint? Because we have listeners in around the globe, and that gives everyone a chance to go, it's of no interest to me. So fill us in on what it is you do and where it is you do it.
Okay, so Global Health develops, as you said, supplies and supports a range of software applications for the health industry. These applications broadly cover a range of, we tend to segment it into four areas: clinical systems, billing and scheduling, or back office administrative systems, connectivity, and we're now focusing on consumer engagement applications. Our initial involvement in health was back in 92, and with what is commonly called a PAS, or patient administration system, that we initially deployed in the public system, but we're now much more focused on independent private hospitals and into clinical systems in the community.
Wow, 92 goes way back in terms of e-health, doesn't
it? That's right.
That's the beginning of time when it comes to e-health?
That's right. My personal involvement goes back 30 years in IT, and that's even more ancient, if you like, in terms of the number of cycles of technology I've been through.
Mathew, you're based in Melbourne, Australia?
Yes, we're headquartered in Melbourne. All our stuff is developed in Australia, supported, supplied primarily to the Australian market, although we're starting to develop quite a promising pipeline of opportunities overseas.
That's interesting, because we do have listeners who are overseas, so maybe there'll be some interesting things to come for them. Now, expand out for me those four you mentioned. You talked about products in clinical, back office, connectivity, and consumer. What's the clinical range that you offer?
So the clinical range, if you like, are applications that support the delivery of healthcare. We developed from the onset the concept of a team-based shared medical record. The product's branded Mastercare, and we see health as increasingly becoming a collaboration of providers that are looking after individuals. So the clinical systems, cater for different roles in the healthcare industry. So specialists and GPs obviously have the full 9 yards, if you like, decision support, meds management, pathology, radiology, and so on. And then for allied workers, health workers, or nurses, or even social workers in the case of chronic disease management, they have the appropriate functionality and the ability to sort of work with the other providers involved in your health. Particularly strong in the mental health area. This is an emerging area that's recognized in Australia, particularly in most developing countries, as and that's been our star in the recent past, if you like. So even though we started off with hospital systems 20 years ago, and that's still very much a staple of our revenue, our growth areas are very much in the area of chronic disease management, mental health in particular, and connectivity. In other words, getting clinicians across your patient journey, if you like, to share information securely, and most recently, we're starting to get into consumer engagement, to get consumers to work with their providers, and for consumers to sort of proactively manage their own health, to stay healthy and well.
That's kind of the future of a lot of the health industry, I think, is consumers seeking to be much more actively engaged in the management of their own health than has traditionally been the part.
Correct. It's across all industries, really. I mean, consumer empowerment is what's driving a lot of the disruptors in industries across the landscape. And in health, traditionally, it's been fairly slow to take up innovation because it's necessarily defensive and cautious. But we see that as a strong area of of potential, if you like, in terms of consumers starting to become more aware of their conditions, of being able to proactively work with their providers. And with the onset of wearables and home device monitoring and all that sort of thing, I think the future is very much about far more consumer enablement, if you like, in the management of the health.
Yes, we're starting to see some serious clinical interest in hospital at home now. The idea of consumers being home monitored and home cared. And let's face it, hospitals are not particularly healthy places to be. They're full of sick people.
I mean, the recent press. That's right. The recent press about the number of deaths here in Melbourne from hospitalizations that could have been avoided. I've heard stats that say, up to a jumbo jet of people die every fortnight unnecessarily due to all kinds of errors that could be avoided. And these are errors that basically are a lot of it is, aside from infection, a lot of it is due to lack of the full information or the full story when care is delivered.
Yes, that's going to be, I think, one of the big changes in the next decade in health is the idea of full information. Mathew, you mentioned back office. Is that billing and scheduling? What do you put into your back office category?
So in our back office category, we've got, billing, scheduling. In the case of hospitals, it's, management of beds, management of theatres, and we also are getting a lot of interest and take up of our data warehouse, which is really starting to get into the big data arena, where we've had clients constantly tell us, look, I know it's all in there in the operational system somewhere, Mathew. We need to be able to get it out, to be able to slice and dice and look at the efficacy of this program versus the other program. Be able to negotiate with the funders, whether it be insurers or Medicare, with meaningful evidence. So within the back office suite, we have the concept of a data warehouse as well that feeds in from both the billing and the theatre stats as well as the clinical information.
Now, is that cloud based or is that in house?
So about 50% of our products, all our products are offered on the cloud. There's always a little bit of a variety of definitions for what the cloud means. All our applications can be hosted in the cloud as a managed service, but in my view, a pure cloud application is when you start offering software as a service, so that you have the concept of multiple tenants across one instance of the application. So in that regard, 50% of our applications are true cloud, and the other 50% are often in the cloud but offered as a managed service. That still gives you the advantage of being to access your data anytime from any device, that sort of thing, but it does require, if you like, your own environment.
It does indeed. Mathew, most of our audience are clinicians. What's the take-home message that you'd like them to have?
Well, I think the biggest challenge in healthcare, in Australia, the tendency has been to sort of import systems from overseas markets, particularly the US and the UK. And these systems fundamentally are different to our health system because in the case of North America or the United States, they tend to be closed networks of health HMOs. And when a lot of these systems are geared towards almost dumbing down clinical practice. Increasingly in local environments in Australia, the clinicians just want to get on with their work, and they find a lot of these clinical systems quite cumbersome. So I think the takeaway message is really about, in my view, getting systems that are fit for purpose, that do the work or the speciality you're after well, whether it's mental health, whether it's obstetrics, whether it's orthopedics, do that well and look to work with other systems. So there has been a tendency for clinical systems to try to be all things to all people. And you end up with 75% of the functionality that is useful, and the other 25% is adds more than the 75% gives you, if you like. So I think if clinicians look at systems that are slick, if you like, they'd be much better off. Our clinical systems always look at the patient as the center of the universe, and patients tend to have episodes that involve care in multiple delivery settings, not just within a hospital, but often it's within GP rooms, specialist rooms, theater, rehab, home, and there's a tendency to sort of automate a facility, a hospital or a clinic, whereas our systems tend to look at it from a patient-centric point of view. So it's all about the patient, and if you happen to be looking at the information in a hospital setting or in a clinical setting, or in fact in a home visit, you really want all the information about the patient to be available regardless of the setting. And that's what we've been trying to do with our shared team-based care approach to clinical systems.
Mathew, it's fascinating to talk to you, given that you have obviously a great depth of experience in the field of e-health. What's the biggest misconception about e-health that you see that drives you nuts and keeps you awake at night?
In Australia, the biggest thing that keeps me awake at night is that we have some fundamental structural issues in our health system, where we've got this fragmentation of responsibility, if you like, between hospitals, which are generally state-based, and healthcare delivered in the community, which is generally Commonwealth funded. So if you look at e-health as all about the patient, then we find it very difficult to be able to, break this current thinking, which is, I want to computerize my hospital. So, let's look about what happens when that patient is in hospital. When really what we would like to say is, look, if a patient ends up in hospital because he's got a mental health issue or a heart problem and so on, that is just an occasion of service within that particular patient journey. So, it's very difficult to sort of talk to a single body that's responsible for the patient journey from the home to the GP, to the specialist, through the pathology, radiology, pharmacy, and the hospital sometimes. So the focus is very much on hospitals. 80% of our expenditure is on hospitals. But to fix that problem, we really have to look at it from a patient perspective, from a patient-centric perspective, and look at systems that work well across different settings and basically uses the internet, which is about connectivity and not about one great big monolithic system. So I think the thing that keeps me up at night is these mega projects. People try and deal with the challenge of health through a single large monolithic system that inevitably fail. This is not unique to health. Any large project in IT tends to have a 80 to 90% chance of failure. And we haven't moved from the mainframe thinking of the past to the mobile and more specialized world of mobile applications that we live with every day on our phones in every other aspect of our life. But in health, I think we're still stuck a little bit in the mainframe monolithic thinking of the past. So these large projects are the ones that frustrate me no end. It also tends to exclude, obviously, innovative, agile, smaller companies like us.
I can sympathise with that view, Mathew. In fact, and for our listeners, we have a 6-part podcast in production currently on e-health, And that's a view that a number of players have expressed. And in our eHealth podcast series, we are going to explore in depth that question of the frequent failures of large e-health systems around the world and what causes it and how it can be fixed and where the future's going. But that's for another day. For today, Mathew Cherian from Global Health, how do people get in touch with you?
So our website is www.global-health.com. The office number is 0396750600, and by all means, just come to the website or send an email at my own email is ceo@global-health.com, or marketing or sales at global-health.com. Lots of ways to get in touch with us.
Now, I'm always in trouble when I give phone numbers. People send me messages on Facebook going, I didn't have a pen handy. So for those people, pencils up. It's time for a phone number again. Just give us that number again, Mathew, please.
So that's 61 for Australia, 3 for Victoria, and 96750600.
So fair warning, please don't Facebook me if you didn't have your pencil ready. Mathew, it's been a pleasure having you on the air with us this morning. We'll put a transcript of this interview up on our website and a SoundCloud archive and also a YouTube archive. So if you've just caught the end of us, please go onto our website at www.hpr.fm and you'll be able to get the transcript and the audio archive there. My name is Wayne Buckler and you've been listening to Health Professional Radio.